Hello.
Oh, hang on. I think I got to turn my volume up. Uh, all right. Can you hear me?
Yeah, I can hear you good.
Yeah, good. Awesome. Right on. How's your day been?
Yeah, pretty good, man. I had a lot of time to, decompress after the conference we just had. So, been cleaning, took my dog for a real walk. He's happy. It's
Nice.
been good.
Awesome. Yeah,
Yeah.
I feel bad because since the snow, we haven't really been able to walk our dog as much as we like to. So I feel bad for him.
Yeah, I don't know. They'll be all right. Just got to go twice as far
That's right.
when the snow melts, right?
Yeah.
Yeah. Yeah. Yeah, no, it's good. We usually go down to the ravine. It's off leash there.
Oh, okay.
So he absolutely loved that. Yeah, yeah, yeah.
I don't know why my camera keeps shutting off on me here. Just hang on a sec.
No worries.
Yeah. All right. I think maybe it'll stay on now. There. Yeah, no, good. Yeah, it's nice when you have an off leash place nearby. We like going to Deer Mound just outside of Sherwood Park. Nice little area for off leash dogs.
Right on.
Yeah.
Right on. Yeah. So how's this interview working when you do them, Chris?
Well, basically, we're kind of looking at this more of like a coffee chat with Chris type thing. It's not very formal. Like sort of the style I have is a little less interview style, more just you and I talking. So I
Yep.
kind of figured we could maybe just talk about PIA. I mean, I don't really know much about it,
Yeah.
you know, so I thought maybe that'd be a
Yeah.
good starting point just to kind of chat about.
Yeah. Yeah, absolutely. And then do you guys use this for like, do you record them and use them, or is it just for your purposes, or how does that work?
So we are actually recording, if you're all right with
Oh,
that.
nice.
Yeah.
Yeah, 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 for sure. I just
Yeah.
wasn't sure. So yeah,
Yeah,
that's
I
good.
mean, basically, my wife and our media coordinator, they take this kind of stuff and they edit it, make it better than I can, and then turn it into shorts and what have you. I know with the interview with Unifor, we actually put the entire thing up on YouTube. After we edited it, made it a little bit nicer. Yeah, just so folks have an opportunity to hear maybe what I'm thinking on certain stuff, you know, uh,
Yeah,
an opportunity to hear what I have to say about it. Because I mean, sometimes a candidate's just a name, right? And
yeah,
I honestly, I love talking to people. That's what I'm really enjoying about being the candidate is getting to hear about so many different professions and different concerns that I had never even considered before.
yeah, yeah, yeah.
Yeah. So
Perfect.
yeah.
Yeah, that sounds good. Right on. Yeah, I'm happy. I'm always happy to chat about PAA and everything else under the sun. It's always nice to be able to connect with like-minded people and really just shoot the breeze, I guess. Yeah, PA's been around for a long time, longer than I knew it was before I started. So I think it started as an organization in 2004. So it's over 20 years old now. We just had our 20th anniversary a year or so ago. And it was kind of started as a response to the Fraser Institute and Canadian Taxpayers Federation and other organizations that were really just sort of like mouthpieces for the conservative movement, right?
Mm, yeah.
Like lower taxes at all costs. Yeah, and in response to that, we're like, well, what if we had an organization that talked about fair taxation and public services that worked instead of just tearing everything apart and saying that, the best way for us to move forward as a province and a country is to cut taxes and defund everything. So that's how it came about. I've been on board for 4 years now, since like 2021, March 2021.
Okay.
So
So
yeah.
with PIA, then it's is it mostly a focus on the healthcare side of things, or is this just in general?
Yep. So
Okay.
yeah, good question. We have seven priority areas, which is way too many most days. But
Yeah.
we primarily focus on seniors care, healthcare,
Okay.
and then public education. Those are the two biggies that we focus on.
Okay. So that was where I wasn't too sure because yeah, I know you guys are big into healthcare. I mean, obviously, that was a part of the reason we had our kickoff today instead of Friday because there is such an overlap in the healthcare industry and NDP supporters that we were kind of like, well,
Yeah,
if we have it on Friday when you guys are busy, no one's going to go up.
yeah,
So yeah,
yeah.
that's okay. So you have seven different spots that you focus on, but yeah, that's that's an awful lot. And
It's
I like how you put it. A lot of people they want their taxes to go down without realizing. what their taxes are really doing. I mean, if we just completely scrapped it and didn't have these programs, that that wouldn't work either.
Yeah, well, I always like to just point out to people, if they want to have a real conversation about taxation anyway, that, if you drive to work in the morning, if you appreciate having a fire station nearby, police station, essential services, and if you've ever visited an ER room with a kiddo or for yourself, then we should probably be honest about taxation. And there's a big conversation to have about fair taxation, make no mistake. But
Yeah.
what we've kind of heard is that like most people just don't really it's sort of like tax is bad. And that's kind of the story, but there's a lot of nuance there, and it's going to be kind of a boring, complex conversation, but really important to think about connection between public services and taxes for sure.
Oh yeah, yeah. I mean, like that was a conversation I've been having with a lot of my coworkers now that they know I'm the NDP candidate. It is
Yeah.
just like my son, just about a year ago, he needed to have his appendix removed. He ended up spending 4 days in the Stollery. So out of curiosity, I did the math on what that would have cost with an American style system, and it would have been about 68,000 Canadian. And when I start talking to people about that, they're like, "Well, that's wild." I said, "Well, yeah, 4 days in a hospital, a relatively easy procedure, but recovery time, all of the medicine they were giving him, the food they fed him, yeah." And I mean, I don't have 68,000, so that's a medical loan now, and that's why we need a truthful single payer system. We need to really make sure that, yeah, okay, healthcare has issues right now for sure, but we need more funding. We don't need to tear it all down. you know, it,
Yeah.
it is one of those things where there are folks I work with that look at what the UCP is talking about and go, yeah, private healthcare would be great, or a hybrid system, some sort of mythical thing where somehow we'd have both. And that's just not practical.
Yeah. Yeah, at the end of the day, I think really it comes down to. Sorry, I'm going to walk and talk. My dog's barking at me here, Chris. I'll take you for a walk in my house.
No worries.
At the end of the day, like when we had our conference with like 200 people were there the last couple of days there, it boiled down to, and Heather Smith from the Nurses Union said this pretty well, is like private bad, public good. And that's basically it. If you look at lab services, if you look at private seniors care, which has been going on in this province for a long time.
Mm-hmm.
Even just the transparency piece too, right? Like we don't know what those contracts look like, where the money's going, what the quality of care standards are. There's just a whole host of issues where, we kind of just take for granted that it'll never be like the American system. But to your point, it's like, yeah, have you ever thought about what it'd be like to stay in the hospital for 4 days if you had to pay for it? No? Okay, well, here's what it looks like. And that's nice about the American system. The one nice thing about it is it's right there for us to see and to say, you know what, we really don't want that.
Well, there's so many horror stories. They post them online all the time. Hey, my dad had a heart attack and had a quadruple bypass, and look at this bill that looks like he bought a house. It's unreal. It's just it's not something we can possibly afford. And the crazy part is it feels like a lot of the people here in Canada that seem to be in support of it, they can already afford to go to, say, Mexico to get dental work done, or travel abroad and go, well, you know what? I couldn't be bothered to wait the 4.5 months. So I just went somewhere else. It's like, it's not your problem.
Yeah. No, exactly. That's not a problem for you. And for me, when it comes down to people who can afford to do it, make no mistake, you can like go on holidays wherever you want. You can go get services wherever you want. That's fine. You can access other services in other places as they exist. But for the average working person and their family, and when I say average, I mean people who are homeowners and, carry a mortgage and, go on a holiday to every year or so, and they're saving up for retirement. Like, hardworking people have a good life, but still they're not going to pay tens of thousands of dollars for that procedure. And then, the other thing is in this province, I think, I'm here for a long time. I grew up in Saskatchewan, moved to Alberta 22 years ago, 2002. So maybe a bit longer than that. Anyway, doesn't matter. But so prairie guy. And we kind of take for granted those things that are really, really important for even just access to an emergency room, right? For free. Yeah. Walking in, the wait times are crazy, make no mistake, but I think that sort of breakdown is by design, right?
Well,
we know that
chronically underfunding, refusing to build new facilities, making it so that nurses aren't interested in staying in the industry. I mean, you talk to a doctor and they say an emergency room without a nurse is a very, very expensive storage closet. So yeah, like you said, it's by design. You have folks that are purposely going out of their way to make the system fail, to then say, look, it doesn't work, let's privatize it. because, hey, that'll make me ultra wealthy. But don't worry about that part. Just worry about the fact that public healthcare is somehow bad for us. I mean, yeah, you're right. You make a great point. There are really long wait times. But when I went into an ER room with a dislocated shoulder, when I started to lose consciousness, I tell you what, I got bumped up to the front of the line pretty quick.
Yep.
We do take
Yeah.
care of the folks needed immediately.
Yeah, and if you talk to the ER docs or the ER nurses and the other healthcare staff in the ER, like they'll tell you it's a staffing problem. It's not a public like healthcare system problem, right? And that takes political will, investment, training, recruitment training, and then the retention piece, right? Like a lot of people are leaving the
Yeah.
professions because it's just, it's a real hazard, day in, day out, being understaffed, working, back-to-back shifts, getting called in for overtime. These are really high stress jobs. And so you can't blame the workers. I mean, like even in seniors care, we were talking about that. It's another piece where we talk about seniors care a lot at Public Interest Alberta. We have a task force and a whole bunch of seniors advocates. And one of the guys has a mom who is in long-term care. She was in private long-term care, and then he moved her over to an AHS facility, and he said it's like night and day just in terms of the standards, right?
Oh, yeah.
So and the costs too. So I think, yeah, it's easy to say something's broken when you've broken it on purpose, right?
Yeah. Well,
But we need to reinvest in that public system.
Well, and just to add a piece to what you're saying there with the retention, I mean, we spoke with a nurse who was working at the mental health ward in the U of A for about 10 years, has completely walked away from being a nurse, is no longer in the profession, and described to me the level of physical danger that she was in. Little 110-pound nurse. And in my mind, I think mental hospital, you think of One Flew Over the Cuckoo's Nest, big burly men that can come down if someone's having a psychotic episode. And she said, no, you're in a room with maybe two little nurses. One of her coworkers had a spiral arm fracture because this person grabbed and twisted their arm. They couldn't work for 6 months.
Totally.
And physical danger where I go, if I felt like I was going to be assaulted when I was at work every day, I don't think I'd go in.
No.
Like I work in an industry where safety is the absolute paramount. I mean, as a pipe fitter, safety is first. Even if it costs money, it slows us down. It doesn't matter. You must be safe. So why is it for our healthcare professionals, it's okay for them to go into an objectively dangerous workplace? And then we wonder why these folks go, you know what, I don't want to do this anymore. I mean, I'm a father. My kids, if they came to me in a few years and said, Dad, I'm thinking about going into healthcare, I'd go, are you sure? Is that a good idea? Do you really want the stress for no pay, no respect, And the number of people I talk to that seem to think all these nurses are walking around making wonderful money. They're not. They're really not being paid well enough for the level of work they're doing.
Yeah. And I mean, you said it, right? You just have to talk to a nurse or any other healthcare professional and they'll tell you what the reality is on the floor.
Yeah.
But unfortunately, we have governments that just don't want to listen to what I call the real experts, which is the workers, the people who know what's going on. But as you said, in different industries like oil and gas, I remember working up in Fort McMurray for a very brief period of time with the union movement, doing some organizing, and there's always ways that safety can be improved, but as a rule, you'd have the safety meeting every morning and you had a health and safety guy. It's completely different than
it feels like there's so many corners that get cut, and it doesn't make any sense. I mean, we had a safety shower, for example. We need a new mixing valve. $3,500. They didn't even bat an eye because it's related to safety.
Right.
Whereas, you talk to these nurses and it's chronically overworked, understaffed, don't have what they need, no support. And it makes you go like, wow. And that's who I want to rely on when I'm injured and I'm having probably one of the worst days of my life and I'm in the hospital.
Yeah.
And this overworked person is what's trying to help me. That's that.
Yeah. Well, yeah, man. And this whole idea, it's a cliche, obviously, but measure twice, cut once, right? You get it right, and then you plan ahead, and you have standards for a reason. In Alberta, when it comes to seniors care, we used to have minimum staffing ratios. So you'd be, hours of care per day, minimum staffing, depending on, and then depending on the complexity of the patient or the resident, you have, different hours. More hours, but it also required to have at least a certain percentage of the staff be registered nursing staff. And
Hmm.
then the UCP government just completely blew that legislation up. So there's no minimum hours of care. There's no legislated staffing type, right? So scope
Hmm.
of practice. And, they just, yeah, I mean, how to make that make sense? You can't call that red tape. We're talking about our parents here,
Yeah. Well, and actually, like you said, just talk to the people who work in the industry. I spoke to a senior care provider who worked with USW under that union,
Yeah.
and
Yeah.
she was saying that she had 12 patients, and she had to get them up, make sure they were dressed, took their medicine, and down to the mess hall in about an hour. And it worked out to something like 6.5 minutes per person. And she said these are the elderly. These people don't move like a 20-year-old in an army barracks, and they
Yeah.
don't necessarily have the same routine. Some of them have different things going on mentally and maybe don't understand, like, you got to go, it's breakfast time, and all of a sudden she's like, now my day's flying by and I just can't keep up. But that's her workload. That's what she's
Yeah.
been told. Hey, these are your patients, you have to get these folks going. And how are you supposed to do that? And
Yeah.
like you said, it's a system that's set up to fail.
Yeah. Yeah. And it's important, I think, when, you start hearing those stories and actually doing the numbers on how many minutes, a day or a morning somebody actually has to do, toileting and medication and wound care, to remember that, like, yeah, that's where we're at today. It's a real mess because
Yeah.
of the underfunding. But it's not that hard to rebuild it. I mean, it's going to take time, it's going to take resources, and you're going to need smart people working on the system. But we know what works, right? You
Yeah.
have well-paid healthcare professionals who are trained and who want to stay in the profession, and you have rigid standards for the quality of care that our loved ones and ourselves are receiving, and you fund it. And you know what? Like, every year, we're telling everyone, to move to Alberta, which I think is fantastic, right? Like, Alberta is a place where people come to have a good life. And, that was my grandparents, that was probably your grandparents or parents, like, we all
Yeah.
have a story like that, go back 2 or 3 generations. It's great that it's a growing province, but with that, we need to account for population growth and inflation when it comes to the services we're providing.
Well,
You got to invest in things that matter. So,
and when
yeah,
I'm in the work truck and the Alberta Advantage radio ad comes on and everybody in the truck scoffs at it, there's an
yeah,
issue. When they're
right,
saying it's the Alberta Advantage, come to Alberta, it's wonderful, and everyone goes, "What are you talking about?"
yeah,
Because lots of folks, I mean, they have lots of family members that work in healthcare or have dealt with healthcare. All of us are affected by this. That's a part of where I go, this just is a no-brainer. We have to do better at funding it, and we have to do better. I mean, all of us need healthcare, and all of us hope to one day reach an age where we are in an old folks home, right? I mean, the idea
yeah,
is take care of our parents and our grandparents, and then hopefully one day we reach that point. I don't want to be in a bag 'em and tag 'em facility. I don't want to be somewhere where I'm obviously a burden and in the way, and people are
yeah,
rushing me and treating me poorly because I'm in the way. Right? I don't want to feel that way. I don't want my parents to feel that way.
yeah. Neither do I.
Yeah.
I want people to be well taken care of. Is that? I mean, are those? I'm curious about what's going on in your campaign. Like, are you hearing about seniors care issues, whether it's seniors themselves or families of people who have parents in the system, or like, what are the issues that people are talking about?
So for me, folks that talk about the senior care, they themselves are at retirement age and usually are already on a fixed income.
Yeah,
Their concern is more so not necessarily the senior care, but the fact that they're pretty much poor.
fixed
They've reached a
incomes.
point,
Yeah,
yeah, like their fixed income is really reached that point. I feel terrible every time I make an ask without realizing that they're on a fixed income. I say, would you be willing to make a donation? They just go, I can't. I
yeah,
absolutely can. I can barely afford my medicine because although we claim to have universal health care, pharmacare isn't covered. So I have to have money for my medication and I have to have money for my groceries. And then, I give a little bit to my grandchildren and all of a sudden it's gone. And I
yeah,
have to wait for the next one. And, do I go back to work? What do I do? And you get folks that are just downtrodden. They don't know what to do. And
yeah,
that's so for the senior citizens part, that's what I've been hearing on doorsteps. For most folks, the major concern has been Trump and
yeah,
the whole economic uncertainty. I mean, lots of people asking me, so what's going to happen? Who can we vote for that's going to make sure we aren't affected? And I've just been honest. I mean, we're going to feel this. these tariffs and this economic attack it's going to hurt. We're going to be facing some hard times ahead, and it's about voting for folks that hopefully are willing to stand up to what's going on. People that go, you know what, like, this is just not an acceptable path forward. I mean, you're supposed to be our biggest trading partner, and yet you're going after us and going, we want to make you into a territory, which is just
it's pretty clear that old relationship that's been built up between the U.S. and Canada over 100 years just going to fundamentally change, and it already has.
There's so many folks that I've talked to. I mean, my dentist, he was saying his parents just sold their snowbird home down in the States. They're going to live up here full time, right? So, like, there's some permanent changes out of this, folks.
I mean, it's the kind of thing that I think a lot of people are just like, there's a lot of uncertainty. I know it's an overused word, but just, you wake up every day and it's not like, oh, it's something you hear about, once a week or once a month or something, and it's far away. It's kind of close to home. And so people are just kind of like, there's a little bit of tension, right? Like, people are just kind of like, worried.
And I mean, it's you hear it all the time, and everyone's uncertain. They're worried. They're stressed out. I was overhearing some of my younger apprentices actually talking about, like, what if we were invaded? The kind of thing that you just go, how are we talking about this? How is this a conversation? It doesn't make any sense. Like, they were our biggest ally for the longest time, and now it feels like, well, unfortunately, we woke up and went, you know what? We should have been diversifying our trade routes for years instead of relying on them for everything.
Yeah, that's true. Hey, it's always hindsight's 2020. I think in this election too, it's important to talk to people about electing strong local representatives. I mean, I know a lot of the airtime is sort of like whether it's going to be, this natural governing party or this natural governing party. But when I remember when I started door knocking, Chris, it was like 2012 provincially, but still, and the NDs were trying to go from 2 to a few more seats. And I was door knocking with that guy named Darren Billis. You probably know him, and he was elected in that election, and it was tough, right? Because it was it was the third or fourth party, and people were like, well, why should I vote for you? And I remember Darren always said, he's like, you know what, I'm from the neighborhood. I'm going to work hard for you, and it's important for us to have real, average, whatever you want to call it, people around the table who are going to stand up for your interests right here in this riding. And it worked, right? Because I don't think people really, I mean, people are scared about the prospects of, one guy over the other at that level. But, in the community, it's kind of like, okay, well, who's going to actually represent me and my interests? And I already know, kind of the way things are going, that it's going to be a tough slog. But yeah, I'm just wondering, like, what your take is on that, because it's just, I think it's important. We need more, not fewer, ideas around the table, as far as I'm concerned.
Yeah, no, I hear what you're saying, and I completely agree. My big thing is that it feels like there's no blue collar representation. It feels like a lot of what we have are lifelong politicians, people that they were lawyers or they were entrepreneurs, and that's great. We need folks like that too. But there's really nobody representing the millions of working class Canadians. There's nobody that says, hey, like, I know what it's like to work paycheck to paycheck. I know what it's like working up in those camps up in Fort Mac, because you get these disconnected officials get elected, and then everybody says the same thing. They're so frustrated that it feels like they're the same person. I mean, when you're voting and the candidates are a bunch of old, rich white guys, they all kind of start to seem really samey. They all went to the same universities and they all have the same background. So, I mean, we really need more representation from folks that we can talk to and actually maybe relate to a little bit better.
Yeah, I'd vote for that, honestly. Yeah, I would say, like, it seems like the longer people in politics, especially, if they're kind of not born into it, but it's like their first or only job, it's like they just seem cooked. They're cooked, like they're just sort of touched. And it's like, you have no idea what it's like to travel across the province to be on a job for 6 months and then fly back home, or, pick up and like put roots down in a completely new province because that's where the work is, or even just be worried about, like, all of us now. It's like I check, the price of groceries like I never used to, right? And there's some things that, you make different choices at the grocery store. It's just, so having that average point of view, I mean, it's it should be the way that it is everywhere
Yeah.
in every riding across the country, but obviously it's not, you know?
Yeah, I mean
Yeah.
that's just it. I've said to a few people, if you feel that other candidates, other parties are more in line with
Yeah.
your values, then absolutely. I don't want to live in a country that has American style politics where you go, is it red or
Yeah.
blue? Pick one. I like
Yeah.
that we have a multi-party system. I really like
Me
that we
too.
have different options, and that doesn't always mean that you're going to agree with the party that's in power and running the country. But the idea is that we work together and find a workable solution forward. I really am tired of this pointing out what everyone else is doing wrong without
Yeah.
saying what we're going to try and do better. This throwing
Yeah.
mud, you get your hands dirty. And
Yeah.
it
Yeah.
seems like we're
Yeah.
getting very American style politics up here. And I've been getting a lot of that too, where people are frustrated. They're tired of hearing attack campaign after attack campaign and hearing the same old adage too that this election is the most important election of our lifetime. I've
I
heard that,
love that one, eh?
I think the
It's
last
like,
4 or 5
man,
elections have been the most important in my lifetime. And it's like, well,
I want somebody to say like this election is the most boring, least important election in our lifetime. Totally. You hear it every time. Every time.
oh yeah, and I'm tired of that. So I mean, I think it's time we start just saying like, yeah, I mean, it's an interesting time in our history, but that's going to be true at the next election. It's
Yeah.
we need we need politics to be boring. We need a bunch of people that just want to go
I
and
think
govern.
politics is boring again.
Well, just people that want to go in, they want to govern, they want to try and make things better for people if they possibly can. Instead of this big showmanship, where everyone's yelling at everybody. I mean, it's embarrassing when you're watching these
Yeah.
politicians debate each other, and it's like watching a bunch of middle schoolers.
Yeah. Honestly, Chris, my favorite stories about politicians acting like normal people come from representatives who've done things like given out their phone number, and respond to constituents. Or there's one guy out in the Maritimes who is retired now, and I can't remember his name off the top, but he, I don't know, he in Ottawa, he would get kind of, I'm not going to say bored, but he really like, his heart was back home and he just loved being a local representative. And so when he was in Ottawa, he would literally just open the phone book and just start calling constituents from back home just to check in. Or, you see those moments kind of where politicians who are even pretty polished, they get caught off guard, not a bad way, but have the opportunity to have a real conversation with somebody. And it's refreshing, right? Because you're like,
Yeah.
I'm so used to the overly scripted stuff. Yeah.
Yeah,
Yeah.
no, I
So
mean that's just it. We need regular people, not this high polished thing. You know what I mean? And like, not to say that politicians aren't real people, but yeah, like it seems very fake, very scripted, and
yeah.
that's just getting tired. That's getting boring. We want regular folk that, what? Yeah, I'll tell you right now, I don't have all the answers. And
Yeah,
that's why I
that's
like
okay.
talking to people like yourself. I don't know
Who does?
anything about PIA before this conversation.
Well, I mean, Chris, like it's like a representative is meant to represent
Yeah.
the ideas and the values and the concerns of the community. It's like you're a conduit, you're a pipeline to Ottawa.
Yeah,
And so, but yeah, I mean, like you don't need to be an expert. You need to, you need to care and be committed and hopefully honest. And people see that. That's a great thing, I think, about. Well, that's the flip side. I think it's a good thing about social media and the kind of, I would say, over professionalization of politics, and it's going back like a lot of years, but especially since the advent of social media and the 24-hour news cycle, is like people see through that though. Like people can smell BS, probably in Alberta more than anywhere else, and so authenticity goes a long way because you don't see it all the time, especially in politics, right? So
Yeah.
I hear you, man, and like it's an exciting time, obviously, like. It's not the most important election because every single one is an important election, but it does make me hopeful. The amount of kind of conversations that I've been hearing, just through PIA and door knocking here and there for some of the candidates that I'm supporting, like my MP Heather McPherson, is that people are kind of plugged in, right? Because they kind of have to be, right, or they feel like they have to be because of the conversation about our relationship to the United States. And there's an opportunity in that, right? Because people, there's so many different angles into a conversation about the state of Canada and, what we care about and what matters. So it's kind of, I don't know, that's the silver lining. I mean, I don't love it, but
Yeah.
there's an opportunity there to have real conversations, which I think is good.
I mean, honestly, it's not great with what's going on with Trump, but I mean, all of a sudden, even Quebec is saying we're Canadian and we're Canadian first. I mean, hey,
Yes.
that's the first time in my lifetime that Canada feels truly united, you know. And we're talking about removing provincial barriers and really starting to work together as a country
Yeah.
instead of being like, well, you know, this part of Canada is great, that part not so much. It's like, no, we're one country and we're proud to be Canadian, and I really like it.